Welcome back to Simply Women's Health with CJ. Today we're going to talk about a topic that is rather difficult for most patients to bring up at their doctor's visits, vaginal dryness. Why does vaginal dryness matter? It's actually a lot more common than you think. Approximately 17% of women in their childbearing years will have those symptoms, and more than 50% of women who are postmenopausal will have vaginal dryness. What are the symptoms? Pain during intercourse. You can have bleeding after sex. You can have more frequent yeast infections, more frequent urinary tract infections. You can have pain when you sit in one position for an extended period of time, or even pain when you go walking. Who is at risk for vaginal dryness? Women who are breastfeeding. When you are breastfeeding, you have a high level of the hormone prolactin. Prolactin is the hormone that creates breast milk. It suppresses estrogen. When you have low estrogen, you can actually be a little bit dry down there. When you are a diabetic, if you have Sjogren's syndrome, if you have had a hysterectomy and had your ovaries removed, different medications, if you are taking chemotherapy, if you are taking hormonal birth control, you can have problems with vaginal dryness. Antihistamines can also dry things out down there. If you are menopausal, that's the biggie. So most patients, when they have vaginal dryness, the first thing they do is go to the local pharmacy and they pick up over-the-counter water-based lubricants or silicone-based lubricants. For a lot of patients, that can work absolutely fine and do the trick. For some people, the liquid or the water-based lubricants can get dry and sticky and actually make things worse. For those patients, I highly recommend you try coconut oil. Coconut oil is a solid at room temperature. It is a nut oil, so it doesn't cause infections, and because it is oil-based and not water-based, it doesn't dry out like the water-based lubricants can. How do you use it? You get a scoop, you get it liquidy, you put it on him. Gentlemen, you get a scoop, you get it liquidy, you return the favor, and I highly recommend you be generous and you be thorough down there. So if you are allergic to coconut oil, mineral oil can also do the trick. It's just a little bit more messy than the coconut oil. If you are using condoms to prevent pregnancy, any of the oil-based products can interrupt the integrity of the condoms, and so they might break. So I don't recommend that. For those of you using condoms, the water-based lubricants are the answer for you. If you are using petroleum jelly, that product a lot of people really like, but it does increase your risk for vaginal infections, so I usually encourage my patients to steer clear of that. If none of this works, I highly recommend you make an appointment with your gynecologist or your primary care provider and let them know that you're having concerns. There are some vaginal supplements that we can give you. It can be a ring, it can be a pill, it can be a cream, and those products can help restore some of the estrogen in your vagina. If you are using estrogen-based products, you can certainly use your lubricants during intimacy as well. If all else fails, please again make sure you see your provider and let them know that you're having concerns. There are some skin conditions that can also cause a lot of pain during intercourse, and that would be something that you would want to be checked for if that's giving you a problem. Bottom line, if you are having pain during intercourse, I highly recommend that you keep lines of communication with your partner open. If you are dry down there, please make sure that your partner knows that it's nothing to do with your libido, but most likely a decrease in your estrogen, and that absolutely can be fixed. Hi, if you're still here, thanks so much for sticking around through the entire video. If you feel as though this information has been helpful to you, or you think you know somebody that might benefit from the information provided in these videos, please feel free to like it, share it, and if you haven't already subscribed, I would love it if you did that. Any and all support that you can provide is so greatly appreciated. As always, these videos were not created as a replacement for a visit with your healthcare provider, rather as a place for you to come for basic, reliable information that is non-biased and hopefully allow you to figure out what questions to ask your healthcare provider at your next visit to best meet your healthcare needs. Again, I appreciate all of your support. If you want to contact me, my information is at the top of this screen, and I will put it in the comment section of this video. That's all I have for today. This is CJ. I'm at your cervix.